Hello, my name is Ross O'Connor, and I'm a student physical therapist at Franciscan University here in Baton Rouge. And this is my final oral exam on depression data set 4. So the experiment studied 100 patients with depression for 12 weeks. The patients that participated in the study received one of the following 3 treatments in no particular order: Paxil, Sarazone, or placebo. The primary efficacy parameter in this particular study was the alteration from baseline in HAM-D, which is Hamilton Depression Total Score. It was determined that inferior HAM-D scores were linked to lower quantities of depression. At the commencement of this study, each patient had his or her HAM-D total score documented. Following the 12 weeks of treatment, each patient had his or her HAM-D total score documented once again. Afterwards, the change from baseline, which is the post-treatment minus the pre-treatment HAM-D total scores figured for each patient. Clinical response and suicide risk of the patients were also assessed in this study to add to the evidence. The intentions of the experiment were to compare the efficacy of the 3 treatments as evaluated by the HAM-D in clinical responses. Lastly, the experiment was purposed to evaluate whether the suicide risk for these 100 patients were comparable to historical database of depressed patients. Here on the left, we have the 2 of the 3 medicines that were given to the patients, the Paxil and the Sarazone. The variables in the depression data set go as the patient number, the patient change HD was the change from baseline in HAM-D total score. The response variable was the clinical response coded as 1 responder, 2 non-responder. The treatment was described as 1 for Sarazone, 2 for Paxil, 3 for placebo, and the suicide risk was coded as 1 low, 2 medium, and 3 high. So the first research question was, are the mean or median changes in the HAM-D total score the same or different among the 3 treatments? The null hypothesis that we created was the change in HAM-D total score is normally distributed, and the alternative hypothesis that I created was the change in HAM-D total score is normally distributed. Here on the right, we have a test of normality, which is done using a Shapiro-Wilks test, which shows the change in HAM-D total score. It was implemented to conclude that if dependent variable was normally distributed, the p-value was less than 0.01. As a result, the judgment was made to reject the null hypothesis and lack of normality is expected. Here we set the Q plots. The QQ plots are the change in HAM-D total score. These compare the shape of the empirical distribution of a sample to the shape of the normal distribution. On the top left, we have the QQ plot for the treatment group Sarazone. Top right, we have the QQ plot for the treatment group placebo. And on the bottom, we have the QQ plot for the treatment group Paxil. Next, the Levine's test of equality of area variances A and B was completed. The null hypothesis was a change in HAM-D total score has an equal variance across treatment groups. And the alternative hypothesis stated the change in the HAM-D total score does not have an equal variance across the treatment groups. This chart shows the Levine's test of equality for area variance of the change in the HAM-D total score. The Levine stat shows based on a mean 1.995 with a DF1 of 2 and a DF2 of 97 with a significant figure of 0.142. The Levine test presented that the variance of the HAM-D total score is equivalent across the groups with the F2 and the F97 equaling to 1.995 with a p-value of 142. Here is just a descriptive for the change in the HAM-D total score. For the treatment group Sarazone, it had a median of -18. For the treatment group of Paxil, it had a median of -15. And for the placebo treatment group, it had a median of -8. Next, a Kruskal-Wallis test was ran to determine if there was a difference in the HAM-D scores between the 3 treatment groups. It was determined that there was a significant difference in the response rated between the treatment groups with a p-value less than 0.001. And following that, while using the Dunn's procedure, pairwise comparisons were implemented to conclude the difference between the tested groups. It was determined that there was a variance in response rate between the Sarazone and placebo groups with a p-value of less than 0.001, and the Paxil and placebo groups with a p-value of 0.005, but not the Sarazone and Paxil groups. And that's what the pairwise comparisons of the treatment group on the bottom shows. It shows these 2 groups that do have a significant difference in it, and the Sarazone and Paxil that does not have a significant. Next, for research question 2, was, are the clinical response rates the same or different among the three treatments? For the null hypothesis, I stated that there is no difference in the clinical response rates among the three treatments. And for the alternative hypothesis, I stated that there is a difference in the clinical response rate among the three treatments. Here, the chart shows the response cross tabulation for the three treatment groups. This was done to determine the variance concerning the expected frequency and the observed frequency. The adjusted standardized residuals were evaluated. For the placebo group, the standardized residuals were greater than plus or minus 2, and then with the serotonin group, they were close to plus or minus 2. For that reason, it was rational to conclude that there is an absence of independence in these groups, but not in the Paxil group. Finally, a chi-square test and symmetric measures was done. This was to test the independence among the clinical response rates by treatment groups, and they were all expected cell frequencies were greater than 5. It was determined that there was a significant association between the clinical response rates and treatment groups with a p-value of 0.008 and a Pearson chi-square value of 9.762. By conducting the Kramer's V measures, which is a measure of association between the two nominal variables, giving a value between 0 and +1, it was determined that the association was reasonably strong given that the Kramer's V value was 0.312. Consequently, the null hypothesis was rejected so that it can be concluded that the clinical response rates are different across treatment groups. Alrighty, and that is it. These are my 3 references for this project, and thank you very much.